Hi, Professor Jenkins. I am Andrew Richards, and today I'm going to be focusing on older adults and sexuality. When you hear of older adults and sexuality, most people tend to get grossed out, freaked out, turned off, because we often believe that older adults shouldn't be having sex. But that's not always the case. Sexuality in life is important to all stages, whether they're young adults, whether they're middle adults, or older adults. Betty Friedan once said, "Age is not lost youth, but a new stage of opportunity and strength." So let's talk about aging just a little bit and how it can be characterized. It is basically mean the changing of physiological, pathological, behavioral, and psychological changes that oftentimes can affect your sexual function. What we have come to realize is the fundamental driving force in human sexuality is often misconstrued when it comes to older adults. So let's define what sexuality would be. According to Urim and Meady, they have described sexuality as the core dimensions of life that incorporates notions, beliefs, facts, fantasies, rituals, attitudes, values, and rights with regard to gender identity and role, sexual acts and orientation, and aspects of pleasure, intimacy, and reproduction, and often involves biological, psychological, social, economic, religious, spiritual, and cultural components. In recent years, we have noticed that older adults aged 65 and older are becoming one of the fastest growing populations in today's world. For example, in the United States, it has been foreshadowed that within the next, let's say, 10 years, in 2030, that the baby boom was from 1946 to 1964 are basically going to be the highest amount of populations that we have. Basically, what that means is that 1 in every 5 persons in the United States will be over the age of 65. As such, oftentimes we hear about the health system when it comes to the older adults. But the sad thing is, most times we often focus on their physical health, their biological health, their mental health, but we never focus on their sexual health. However, researchers have argued that sexual needs remain important to all ages, and that does not eliminate sexual desires when it comes to older adults. Yet we are still astonished that the older folks, or as we call the older adults, still do have sex. But one thing that they do come across is ageism. Have you heard the saying, the older the grape, the sweeter the wine? But in recent years, again, most people are freaked out because when we hear ageism, we think they're weak, we think they're old, we think they're helpless. Though they may age, that's not always the case for everyone. And it's very much stereotypical to say that every old person that one comes across is helpless. No, that's not. And you'd be surprised that they are still sexual beings who desire to have intimacy with a partner. However, we still see them as non-sexual beings who are undesirable and should not, cannot, and do not want to have any sexual relations. Let's just face it, we have false expectations for older people, and this all stems from the ideals of beauty or the biomedical perspective of older adults and the association that sex has to mean reproduction. In the Western society, sex is for the young, the beautiful, the healthy, the married, in most cases, heterosexual. And that's basically a feminist theory, term to charm circle of sexuality. However, in contrast, sex among older adults is again seen as shameful, it's considered disgusting, laughable, pretty much non-existent, which can again internalize stigma, increase sexual, problems for older adults. Can you imagine if you heard your grandmother say, "Well, yeah, I still have sex with my husband," and all her grandchildren was like, "No, grandma, that's disgusting. You all shouldn't be doing that." How he or she may feel? It's quite sad. And oftentimes, if older adults are still having sex, they may be considered cougars, manthers, sexy seniors, dried up old men and women. But what we have come to realize is that sex is significant to older adults. To older adults, it's viewed as an expression of passion, affection, admiration, loyalty, a renewal of romance, a general affirmation of life. It brings joy, growth, and experience. It's such amazing when you really hear how older adults think about sex. To some, it still might seem crazy, but to me, I find it quite interesting. Would you be surprised to know that there are sexual benefits to those who have sex, especially that of the older adults? Increases their cardiovascular health, increases relaxation, decreases pain and sensitivity, decreases depression, and increases self-esteem. Let's talk a little bit about their sexual function. So, sexual activity is a means for the elder to affirm physical functioning and to maintain a strong sense of identity, establish self-confidence, and to prevent anxiety, and that includes 4 stages. So you have the excitement stage, you have the plateau stage, you have the orgasmic stage, and you also have the resolution stage. So within the excitement stage, sadly, erections take longer, firmness of erection decreases, lubrication decreases, the clitoris may get smaller. However, in the plateau, the vagina increases less in size, decreases, whilst the corpus gland secretion decreases and there is a decreased ability to maintain an erection before ejaculation. In the orgasmic stage, there's a decreased need to ejaculate and the force and volume of ejaculation. Likewise, women experience shorter orgasmic phase and many may experience sharp pains in the uterus. And there also might be a longer refractory stage. Nevertheless, the saying is true. If you don't use it, you will lose it. And that has also, again, been proven true. So, once again, sex is very important to the older adults. If they don't have sex frequently or have sex enough times, they're going to be able to use everything. Strange, right? However, when it comes to sexual function, still, there are several deterrents, again, that might cause their sexual function to decrease or point blank period stop. And that would include, lack of a partner, loss of interest in a partner. Sometimes their physical health might be poor, their mental health might be poor. They might have, schizophrenia or dementia. Some of them might fear having, a stroke or a heart attack or even fear death. Another thing that is important that can hinder their sexual function would be that the privacy, especially in living arrangements such as nursing homes and other institutions, it'll be hard for you to try to get your quote-unquote freak on when you have nurses coming in and out into a facility where you stay. And as such, it helps to decrease their sexual functions. And as social workers, we should not believe that we are experts in sexual function unless we are advanced in training. But anytime older adults ask a question regarding sex, we should be willing to associate them in answering any questions that they possibly may have. When it comes to physical changes with aging, access to medical intervention such as hormonal therapy or medication. With that said, let's talk a little bit about sexual disorders, dysfunctions, and diseases. Sexual dysfunctions refers to the problem occurring during any phase of sexual response cycle that prevents the individual or couple from experiencing satisfaction from the sexual activity. So, some of the categories that sexual, disorders and functions can fall in could be desire or disorders, arousal disorders, orgasm disorders, and pain disorders. And just to let you know, sexual dysfunction does not only affect older adults, it also affects younger adults as well. So, however, it's more common with older adults. So let's talk about diseases. When you talk about diseases, it affects their mobility and tolerance of physical activity. Also, reduces sexual desire, and body image and perceived attractiveness are modified by aging and diseases, which will reduce the desire for relationships. So some common diseases or medical issues that the older adult or the older population face, that'll include arthritis, depression, stroke, diabetes, illness. Some people visual and hearing impairment, lower urinary tract symptoms, and incontinence. For example, with cardiovascular illnesses, it can lead to erectile dysfunction. With strokes, it can cause incoordination and sexual problems related to contractures. With diabetes, it leads to neurovascular insufficiency and may underlie frequent urinary tract infections and reduced vaginal lubrication. Shall I go on further? Let's do one more. Let's talk about the psychiatric illnesses which can impact sexual function in older adults. Basically, that means like depression and anxiety, which is often common in older people, and that can affect their sexual desires, their arousal, etc. Especially not just mentally, but sometimes the medication that they're given can cause them to not be able to sexually function. With that said, when we talk about diseases, we also want to include sexual transmitted diseases. So, when you talk about sex and you talk about diseases, we can't forget that older adults are susceptible to HIV, STDs, gonorrhea, chlamydia, etc. Not that they are unaware, sometimes they can be lack of education, sometimes, and not just that, barely get investigated about the STDs and whatnot among the older adults. So as healthcare professionals, we should address sexuality with our patients, especially if they're having sex. And it's not just for the younger counterparts, it's for everybody, that they should be protected at all times. Another sad thing that I came across when doing the research on older adults and sexuality was that of sexual abuse. And basically it means non-consensual sex contact of any kind. That could mean rape, that could be battery, sexual battery, sodomy, coerced nudity, sexual explicit photographing, etc. And they can't say no, or it's hard for them to say no, or they're forced into it. It's sexual abuse. And it's sad to say that it's the most hidden form of elderly abuse and is the least acknowledged and reported type of elderly treatment. But let's just talk about a few of the signs that you might see when it comes to older adults being sexually abused. When you talk physically, you might hear that they might have pelvic injury, they might have problem walking or sitting, they might have bloody stains on their underwears, bruises on their genital area, they have irritation, around their genital area or their anus. They have suddenly developed a sexual transmitted disease. When you talk about behavioral wise, they might become withdrawn, they might become irritated, they might attempt suicide, they might attempt to show or engage in inappropriate, unusual, or aggressive sexual activities. Sometimes they might even show post-traumatic disorder, stress disorder, or even panic attacks. In the year 2018, it was recorded that elder abuse was high in institutions such as nursing homes, long-term care facilities, and sadly, 2 in 3 staff reported that they themselves have committed abuse. And not just that, it has been shown that nursing homes and other facilities are inadequate as to how to handle the abuse cases. And there is a need for more knowledge and training among health professionals and giving guidelines for handling these type of cases. So let's just wrap it up. In conclusion, it has been identified that sex is quite important for all older adults, whether it's behavioral, physiological, physical. However, older adults do face ageism, other stigmas, and attitudes regarding their sexual freedom. Likewise, aging and other factors such as diseases, sexual disorders, and dysfunctions may also negatively impact sexual functions for older adults. And it has also been determined that sexual abuse is the most hidden form of elderly abuse and the least acknowledged and reported type of elderly mistreatment. Thank you so much and do enjoy the rest of your day. Remember, the older the grape, the sweeter the wine. Thank you.